Welcome back to News This Week in Nursing Homes. I'm Nurse Buck. A new study reveals significant disparities in supplemental coverage between traditional Medicare and Medicare Advantage beneficiaries. While Medicare Advantage plans are marketed for offering dental, vision, and hearing benefits, enrollees are unaware of services, and usage rates are similar to those of traditional Medicare. Data from over 76,000 non-dually eligible beneficiaries showed that Medicare Advantage enrollees paid slightly less out of pocket for certain services, such as eyeglasses and dental visits, compared to traditional Medicare users. For instance, Medicare Advantage enrollees spent $206 on glasses versus $226 for those on traditional Medicare. There were no significant differences in access to services like eye exams and hearing aids. Despite receiving $37 billion more annually from taxpayers than traditional Medicare, Medicare Advantage plans spending on services like dental, vision, and medical equipment totaled only $3.9 billion, while enrollees and private insurers covered an additional $12 billion out of pocket, raising concerns whether increased funding for Medicare Advantage plans effectively benefits enrollees, highlighting the need for improvements in how supplemental services are delivered and communicated. A $20 million federal grant program designed to attract nursing students to work in nursing homes has called for expansion to include the broader LTC sector, such as AL facilities, but notes potential strain on other care settings if incentives are limited to only nursing homes. The program offers financial incentives of up to $40,000 for tuition reimbursement or $10,000 outright for nursing students who commit to working in nursing homes and state survey agencies. While the initiative aligns with CMS's recent efforts to address staffing challenges in SNFs, there's urgent need for the workforce to support across all LTC settings. A 2023 workforce report revealed a projected need for over 20 million direct care and other workers by 2040, including more than 500,000 RNs and LPNs, over 2 million CNAs, and 12 million personal care aides. By 2024, senior living communities alone will require an additional 3 million workers. CMS must invest in the entire LTC workforce and expand grant programs to support nurses in AL and memory care settings, including loan forgiveness, tax credits, apprenticeships, and immigration reforms to ensure that all LTC settings meet growing demand for care. At least 3 facilities, 2 SNFs, and 1 AL facility have been destroyed in the Southern California fires. Over 35 facilities have already been evacuated, with residents relocated to nearby care centers, hotels, and public shelters. The California Department of Public Health emphasized that facilities are required to implement disaster response plans, including evacuation protocols. And while evacuation efforts safeguard residents and prevent injuries, clinicians report critical shortages of supplies, including gloves, respirators, and incontinence products, particularly at the initial relocation sites like Pasadena Civic Center. Residents eventually transferred to hospitals and other care facilities, but many remain in temporary placements due to expanding evacuation zone and logistical hurdles. The situation is further strained by massive utility outages and staff shortages, with some workers losing homes to the fires. The fires in Pacific Palisades and Eaton Canyon consumed over 37,000 acres, destroying more than 12,300 structures. Emergency preparedness efforts continue, with local health officials and organizations like Leading Age California working to coordinate resident placements and accept donations of food, supplies, and funds to support affected communities. Despite efforts, the situation remains dire, underscoring the importance of robust disaster planning and interagency collaboration to protect our vulnerable populations. Thank you for joining me for News This Week in Nursing Homes. To get more of QSource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.